The people that I'm speaking to are technically savvy, like using tools, are familiar with alternative modalities, are comfortable being guided and coached, and are high performers looking to streamline their time and health conversation in one. So I know that exercise is good for me, but I don't always have time to run every day for an hour. So like, Sandy, do you have a solution for like some things that I could do that are just as good? One of the other things that I use a lot is I call myself the athlete's physician and the working man's physician. I'm not a 9-to-5er. I treat patients when they're done working and on weekends. There's a lot of that demographic that's willing to do that work, but they all have a 9-to-5 and they can't pay the bills if they're gone, in a 2-hour consult with me. And that's how I work. I don't do 7-minute consults. Game changers, high performers, those are the kinds of terms that I use to identify with the population that's like, how can I be optimal? Who's having that conversation? No one's having that conversation because we don't have a support system around it. Well, that's where I come in. That's the difference that I make, because I will help you shift to be optimal. I will have those sexy conversations about how you can be more optimal, and how when people see you and you tell them that you're 40 or you're 60 or whatever, and they say, what the heck are you doing? And you say, I'm just putting it all together. I'm working with a functional medicine practitioner who's helping me understand that all of these inputs matter. And then you see long-term how all of those little things that you did matter. Once you start adopting them into your life, then the next thing becomes easier and you get hungrier for more. Well, I did this in my water hygiene and I've cleaned up my sleep hygiene. How can I be smarter in my exercise? And you start putting them all together, and then you start seeing the true inertia of having them all together. And the other beautiful output of that is it's contagious. You're going to start creating a tribe of people that you're going to draw to you. It might start to spill out into your family, your spouse, and again, wherever they're ready in their journey, whatever little input they're willing to adopt is going to make them better. It's going to make you better, and that's going to create the ripple effect that's really going to turn chronic disease around and start to shift our mortality tables.